Welcome back. Rhonda Heinrichs is with us. Rhonda administers the Patient and Family Advisory Council, or PFAC, at St. Pete's Health. Thanks for joining us again, Rhonda.
You're welcome.
So we've been talking about PFACs and PFAC members, and so could you talk a little bit about the PFAC team members maybe being kind of a conduit to the community? Is that an accurate statement?
That's a very accurate statement. They're kind of our liaison. We give them information about what's going on. We end every meeting with our good news, things that have happened that are great, and we want them to help us share the good news. Kind of through the whole meeting, we work through things that we should be working on, that maybe aren't such good news and areas of opportunity. But we want them to help us get the news out to the community that we are working on things, and we know that we have areas of improvement, but we're trying hard.
That's outstanding. So what kind of feedback do you get, either from folks at the hospital, patients, or both, about having a PFAC at St. Peter's?
What kind of feedback? Well, I have to tell you, I personally enjoy it so much. You come there and I get a little bit nervous when I have to run the meeting because I never know what to expect.
Absolutely.
But we always come out of there with great ideas, great questions. Most recently, we had somebody that wanted to learn more about the safety or the security of our electronic medical record. So we invited Dr. Jonathan Griffin to the meeting, and he was able to kind of ease everybody's mind there that we have a very safe and secure system. Another thing that came up was opioid use within our Helena area, and that's one that we'll tackle at another time. But we just learn a lot about different things by inviting guests, and then our community members get to share the word with us.
That's excellent. So why are PFACs important to improving the quality of care?
Oh goodness, I think one of the main reasons is that our patients and family members feel heard and maybe have a voice in helping us bring about really good change.
Awesome.
So I guess that would lead to patient satisfaction. And then the team that we have there of our own employees, happy employees leads to happy patients or informed. And we would like people to be informed and know that we want to be transparent and we want help and we want to improve where we need to improve and we want to share our good news.
Excellent. Is this a new concept to healthcare?
I'm not sure. It seems like it shouldn't be new. It's fairly new to me. I took over this close to 2 years ago. And I actually volunteered for this because I thought, what a great idea. What a great idea to get people's input. And in my role, I get a lot of the patient complaints or the attaboys. So I have a pretty good understanding of what's going on and what needs work on, and I think this helps getting input. I think you had our good friend Chris on recently, and just having his input, his expertise, his experience, and then sort of his leadership, it really helps us as a group, and then I keep saying getting the word out to others, but that is a big part of it.
Absolutely. So can you talk a little bit more about the shift to person-centered or family-centered care? You were talking about that as we just opened earlier. And what does providing person-centered care, what does that really mean?
Oh gosh, we could go on for an hour on this one. But so the patient should be at the center or at the core of our team. So place the patient in the center, and then the team works around them. And so our team consists of whoever their provider is. Maybe it's a nurse practitioner, maybe it's a physician's assistant or a physician. And then that care provider's either MA or LPN that rooms the patient. Then there's a care coordinator, and the care coordinator kind of takes care, kind of the charge nurse for the day, takes care of the daily activities of the clinic, watches the quality metrics. And an overarching part of this all has to do with quality and making sure that there aren't gaps in care, that if you need your flu shot, we're going to give it to you today. You don't have to come back for that. That would be silly.
Absolutely.
So we're trying to take care of quality care. Like I said, we have a pharmacist. Maybe you have a new diagnosis of diabetes. Too bad. It would be great if you didn't have to leave and come back for that training. So we have the diabetic the pharmacist there, and he or she can do that education, possibly with the worm handoff. I talked about a little bit about having a social worker there. You know, one of the #1 issues in Montana, unfortunately, is suicide. So everybody, CMS, Centers for Medicare and Medicaid, are mandating that we ask everybody every time, have they had any suicidal thoughts? And there's a questionnaire that people get, and I think it's a little bit of an awkward situation sometimes, but that's because we want to take care of the whole patient. And if there's an issue, then we hand off to our social worker. So there's a group of people that take care of this one person, and hopefully we don't miss anything. And our ultimate goal would be to have, you know, a very happy patient that is taken care of when they should be taken care of. You know, they don't have to go to the emergency room, even though we have a great emergency room. We don't want them to have to do that. We want them to have their team that can take care of them in their home or in their clinic or wherever that may be.
Makes complete sense to me.
Yeah.
So we have time for one last question.
Okay.
And maybe we can talk about how someone then would get involved with St. Pete's PFAC or any other hospital PFAC for that matter. Yeah.
So we only have the one here, and they could call me.
Perfect, and
Yeah.
I'm sure that we can get your information put up on the screen
Right.
so
Yeah.
that will be available.
Okay. Yeah.
Thank you so much. I learned so much today. I really didn't have a lot of knowledge about PFACs, and you've really helped open that up for me, so really
Well,
appreciate it.
Thank you for having me.
Yes, and our viewers will appreciate it as well.
Good.
Thank you.
Thanks.
It's time for another break. Up next, we're going to meet one of the members of St. Pete's PFAC who will tell us how they got involved and how they enjoy being part of the hospital's PFAC. Stay tuned. We'll be right back.